This lecture has been prepared as an integral part of the project developing a higher education curriculum in SET teaching for the health, protection and promotion of intellectually disabled individuals. My name is Sabina and I will talk about the infection diseases. The global pandemic COVID-19 has spread rapidly around the world, infecting millions of people and putting countries' health systems to the test. The pandemic highlighted the vulnerability of certain groups of people, such as the elderly, pregnant women, and the homeless, but less obvious was the plight of children with intellectual disabilities, who have a range of vulnerabilities, including health problems, mental disorders, and social disadvantages. Cognitive impairment contributed to their limited ability to understand the information they needed to protect themselves, and they relied on their parents or caregivers to protect them as best they could. Children with ID are vulnerable, especially in situations beyond their control, and rely on adult caregivers to be protected. In the future, it is important to learn from the impact that COVID-19 has had on children with ID. Evidence-based approaches that build on the lessons we learned during the pandemic should help empower children with ID and their parents or caregivers to manage infection disease. This lecture aims to provide understanding of infectious disease management intervention and strategies in education for working with children with ID. Learning outcomes are: develop the ability to understand the principles of disease transmission and the factors that contribute to the spread of infections. Learn how to effectively communicate accurate information about infectious diseases to others, dispelling myths and promoting evidence-based knowledge. Develop the ability to recognize the signs and symptoms of various infectious diseases and understand their implications on individuals and communities. Learn advantages of early detection and timely intervention in the management of infectious diseases. Infectious diseases. Infectious diseases have always been the focus of interest. They are characterized by the fact that they occur unexpectedly, spread rapidly and widely, affect large numbers of people, and have a high mortality rate. Even today, epidemic outbreaks cause great anxiety and fear, and so it is no wonder that ancient writers compare them to one of the four horsemen of the apocalypse and ominous metaphors for all evil, which from time to time bring the wrath of God upon mankind. In historical recommendations, we read of epidemics of great magnitude that last for years and lead to many deaths, great suffering, and unspeakable poverty. Although experts have worked hard over time, until recently they did not know the cause of these diseases, nor did they know how they spread and how to control them. It is impossible to determine when infectious diseases began spreading around the world. It is rare to find traces of infectious diseases on skeletal remains from historical times because they die too quickly for the characteristic changes to remain on the bones, as is sometimes the case with chronic diseases. It was only when people began to write down the phenomena they observed that they were able to leave their descriptions of diseases that had significantly shaped their era. An infectious disease can be defined as a disease caused by a pathogen or its toxic product transmitted from an infected person, animal, or inanimate object to susceptible host. Infectious diseases are responsible for a tremendous global burden. They affect public health systems and economies worldwide and disproportionately only affect vulnerable populations. Only 10 years ago, infectious diseases caused more than 45 million years of life lost due to disability and more than 9 million deaths. Lower respiratory tract infections, diarrheal diseases, HIV, AIDS, malaria, and tuberculosis are among the leading causes of total global mortality. The global burden of infection diseases. Infectious diseases have been a major cause of human suffering throughout human history, both in terms of morbidity and mortality. Various steps in human civilization influenced the spread of infectious diseases. For example, parasitic and zoonotic diseases became more common after the domestication of animals, and airborne viral and bacterial infections became more common after settlement and urbanization. Over the centuries, humanity had suffering from major pandemics such as plague, chickenpox, cholera, influenza, as well as the acquired killers of chronic infection diseases such as tuberculosis and syphilis. Infection diseases include emerging infection diseases like diseases that are newly emerging, e.g. COVID-19, or already exist but are rapidly increasing in frequency or geographic extent. Control and prevention of infection diseases are based on a thorough understanding of the factors that determine transmission. However, deaths from the infection disease, HIV, AIDS, and tuberculosis have declined significantly in recent years and are no longer on the list of the top 10 causes of death worldwide, although these diseases are still a leading cause of death in low-income countries. An emerging infection diseases, COVID-19, caused by the SARS-CoV-2 virus, became a leading cause of death in 2020. At the peak of the outbreak, COVID-19 was listed as the leading cause of death in many countries worldwide. For example, the Spanish flu, which occurred in 1918-1919, was a global influenza pandemic. It infected an estimated 500 million people worldwide and caused the deaths of 20 to 50 million people. The Spanish flu had a significant impact on public health system, economies, and social structures. Modes of transmission of infection diseases. An infection agent can be transmitted from its natural reservoir to a susceptible host in a variety of ways. There are different classifications for the mode of transmission. Here is one classification. Direct, which is direct contact, droplet transmission. Indirect, which is through the air, transmitted by vectors, mechanical or biological. Direct transmission. In direct transmission, the pathogen is transmitted from the reservoir to a susceptible host by direct contact or droplet transmission. Direct contact occurs through skin-to-skin contact, kissing, and sexual intercourse. Direct contact also refers to contact with soil or vegetation that harbors infection organisms. Droplet spread refers to the spraying or relatively large short-range aerosols produced by sneezing, coughing, or even talking. Droplet spread is classified as direct because it is transmitted by direct spraying over several meters before the droplets fall to the ground. Indirect transmission. Indirect transmission refers to the transfer of an infection agent from a reservoir to a host through airborne particles, inanimate objects, vectors, or live agents, vectors. Airborne transmission occurs when infection agents are transmitted by airborne dust or droplet nuclei. Airborne dust includes substances that have settled on surfaces and are resuspended by air currents, as well as infectious particles carried off the ground by the wind. Droplet nuclei are dry residues less than 5 micrometers in size. Unlike droplets, which fall to the ground within a few meters, droplet nuclei can remain suspended in the air for a long time and be blown over long distances. Means that can indirectly transmit the infectious agents include food, water, biological products like blood, and vomit like inanimate objects such as tissue, bedding, or surgical scalpel. A carrier can passively transmit the pathogen just as food or water can transmit the hepatitis A virus. The carrier can also provide an environment in which the pathogen grows, replicates, or produces a toxin, just as improperly preserved food provides an environment in which Clostridium botulinum produces botulinum toxin. Vectors such as mosquitoes, fleas, and ticks can transmit the infection agent purely mechanically or can support the growth or modification of the pathogen. Occurrence of epidemic diseases. The level of a particular disease that is normally present in community is called the baseline or endemic level of the disease. This level is not necessarily the desired level, which may in fact be zero, but the observed level. If no action is taken and the level is not such that the pool of susceptible individuals is exhausted, the disease may continue to occur at this level indefinitely. Sporadic refers to a descent that occurs infrequently and irregularly. Endemic refers to the constant presence and or usual prevalence of a disease or infection agent in a population within a geographic area. Hyperdemic refers to a persistent high incidence of disease. Occasionally, the level of disease in a community increases beyond expected levels. Epidemic refers to an increase, often sudden, in the number of cases of disease beyond that would normally be expected in that population in that area. An outbreak meets the same definitions as the epidemic, but is often used for a more limited geographic area. The cluster refers to a collection of cases grouped by location and time that are suspected to be greater than the expected number, even if the expected number is not known. A pandemic refers to an epidemic that has spread across several countries or continents and usually affects many people. Epidemics occur when a pathogen and susceptible hosts are present in sufficient numbers and the pathogen can be effectively transmitted from one source to susceptible hosts. What exactly is a pandemic? This video will help students answer the question, what exactly is a pandemic? During this video, students will learn how epidemiologists, also known as disease detectives, classify levels of disease occurrence as endemic or as cluster outbreak, epidemic, or pandemic by using number of cases, location, and time. They will also learn how health is defined and about the people involved in keeping us healthy as individuals and as all communities. Educational video is a part of CDC academic curriculum. Video is produced by CDC Nerd Academic.
What does it mean to be healthy? Health is not just the absence of disease. Health is a person's physical, mental, and social well-being. A person's health is affected by many factors, including their biology, their choices and behaviors, and their environment. Some diseases are influenced by genes inherited from parents. People may also be at risk due to their age, previous medical history, or biology. People can strive for good health by making positive choices and choosing health-promoting behaviors whenever possible. Positive choices can include regular exercise, healthy eating, self-care, and having healthy social connections with others. Often, these choices and behaviors are influenced by the people closest to a person, such as their family and friends. Conditions in the environment where people live, work, and play can also affect a person's health. Stress, now recognized as an important risk factor, can stem from family relationships, school, living, and societal conditions. These environmental conditions, also called social determinants of health, include things like safe housing, discrimination, pollution, language skills, and access to education, nutritious foods, and healthcare. When a person feels unwell, they might see a healthcare provider such as a medical doctor, nurse practitioner, or therapist to help them get better. Healthcare providers focus on the individual's health. They use their knowledge and experience to diagnose and treat health problems to help individuals improve and maintain their well-being. When a health problem affects a group of people, public health workers can help solve or reduce the problem. Epidemiologists, laboratory scientists, health educators, and other public health experts use their expertise to improve and protect the health of communities. Public health experts protect and improve the health of communities through programs, policy recommendations, health education and outreach, and research for disease detection and injury prevention. These can include creating public programs like restaurant inspections, vaccination clinics, or laws like limiting smoking areas that reduce public exposure to harmful materials. They also include investigating and preventing disease outbreaks. In essence, public health can be described as what we as a society do collectively to assure the conditions in which people can be healthy. Meet Ezra, an epidemiologist. As a public health professional, Ezra monitors the patterns and frequencies of diseases, conditions, or behaviors that affect health. He tries to understand disease causes and the individuals who are at a higher risk than others for being affected. His goal is to use what he learns to help control or prevent disease in the community. For example, Ezra may investigate a pattern of lung problems among young people. Data may indicate an association between these lung problems and use of vaping devices or e-cigarettes. He uses what he learns to help control the problem by taking actions with the help of other public health experts and health and government organizations. These might include creating health messages, explaining the dangers of vaping, promoting policies to reduce access to vapes for young people, or offering training classes to parents on the risks for vaping among teens. Depending on what is happening in the community, Ezra may examine different types of health problems, such as harmful exposures to chemicals or toxins in the environment, injuries, natural disasters, and diseases. Some diseases are infectious, which means they're caused by an infectious agent that lives and multiplies in the infected individual. Some infectious diseases are considered contagious. Contagious diseases are infectious diseases that easily spread through contact with other people. For example, measles is a contagious disease. Other diseases like asthma or cancer are not infectious or contagious. Infectious diseases are caused by infectious agents such as bacteria, viruses, parasites, and fungi, which multiply within an individual host and cause damage. You may be most familiar with infectious diseases like influenza or the flu, or salmonellosis, which you might know better as food poisoning. Sometimes, an infectious disease is caused by an infectious agent that is new to science, or is an agent we know about but hasn't infected humans before. If the agent is a virus, we call it a novel virus. And not novel like a book, but novel as in new or unusual in an interesting way. When novel viruses arise, few, if any, people have any natural resistance to the infections they cause. If these novel viruses can spread rapidly from one person to another, infection may become widespread across countries and continents. For example, the common cold can be caused by a type of coronavirus that is already familiar to science and produces mild illness. However, in late 2019, the world began to experience another type of coronavirus. This type was one that had not been seen before and led to the COVID-19 pandemic. The virus that causes COVID-19 is a novel virus. It is a new, previously unrecognized type of coronavirus. Part of Ezra's job is to detect and control outbreaks of disease in his community. He monitors disease levels by counting cases of specific diseases. Ezra looks for patterns in the location of cases as well as changes in the number of cases over time. Decreases may indicate that prevention strategies for certain diseases are working, while increases may indicate problems that need to be addressed. Ezra may want to classify the disease levels in the community. Common levels of disease occurrence used by epidemiologists include endemic, cluster, outbreak, epidemic, or pandemic. We say a disease is endemic when there is a constant amount of that specific disease present in a geographic location, like a state or a country. For example, malaria is endemic to Nigeria, where the particular mosquito that carries the malaria parasite is normally found. Both the mosquito and the parasite can be found there, and because prevention strategies are limited, malaria continues to spread at constant levels each year. Malaria is not endemic in areas where the malaria-carrying mosquitoes and the malaria parasites are not found together. For example, in the United States, malaria is not endemic. Although the malaria-carrying mosquitoes are found there, the malaria parasite is nearly absent due to previous public health preventative measures. Therefore, malaria spread is not expected to occur within the United States. There are a few cases of malaria reported in the United States each year, but these mostly occur in people returning from traveling in countries where malaria is endemic. Sometimes the number of people experiencing the same health problem in an area rises unexpectedly, so Ezra would investigate to find out why. Ezra would compare this number to the expected level of the problem in the community. Sometimes one case of a disease is enough to trigger an investigation, especially if the disease is unusual and severe, like human rabies, or can spread easily and quickly, like measles. On the other hand, some increases in disease numbers are expected during the year. Going from 100 to 300 cases of influenza in some areas during November through December would not be unusual for a seasonal disease that is endemic in the United States during the wintertime. A cluster is a group of cases of the same health issue that occur in a limited geographical area, like a school or neighborhood. The expected number and specific details of the source and cause of the cases might not be known yet. For example, several students may present with food poisoning symptoms at a local high school in the same month, or 3 children may be diagnosed with cancer in a particular community during the past 2 years. Ezra's job is to investigate the clusters to determine if the number of cases is above expected, and if so, why. The number of students with food poisoning symptoms is likely more than expected, but the cancer cases may not be, particularly if the children have different types of cancer. Epidemiologists often compare the number of current cases of a disease to the expected level, or baseline number of cases that is usually present in a particular location. The expected level may be known through past and present records or public health surveillance. If the number of cases is more than expected, a cluster is called an outbreak. An outbreak is a greater number of cases than expected in a location within a certain time period. Usually, cases are presumed to have a common cause or be related in some way. During an outbreak, Ezra would gather information to look for a cause. For example, in the food poisoning scenario, Ezra interviewed the students and determined that the common source was cookie dough from the school's fundraiser. Ezra worked with school officials to stop sales of the fundraiser cookie dough, share the dangers of eating any raw cookie dough, and make recommendations on how to safely make, store, and consume cookie dough. An epidemic is an outbreak either with a larger number of cases or occurring over a greater area, or both. For example, the local cases might be part of a larger epidemic if the cookie dough was a commercial fundraising product sent to high schools all over the country, leading to food poisoning cases in multiple states. Typically, a pandemic is bigger than an epidemic and includes spread over several countries or continents. Usually, for this to occur, the disease is spread easily from person to person. When a disease spreads at this level, declaring a pandemic makes resources more available to governments around the world to work together to share knowledge, learn from each other, and cooperate to overcome the global challenge. So, as a recap, let's answer the question, what exactly is a pandemic? A pandemic refers to a disease event in which there are more cases of a disease than expected spread over several countries or continents, usually involving person-to-person transmission and affecting a large number of people. Pandemics often remind us of all the people who work in the background to keep us healthy. These include not only healthcare providers who care for and treat health problems in individuals, but also public health workers who protect and improve the health of our communities. Epidemiologists are public health experts who monitor and study patterns in disease occurrence data. These data come from counting cases described by person, place, and time. Patterns in data tell us the level of disease: endemic, cluster, outbreak, epidemic, and pandemic. Endemic is when cases are generally constant and occur regularly and in a specific location. Cluster refers to a group of cases of the same health issue that occur in a limited geographical area, like a school or neighborhood. Outbreak refers to a greater number of cases than expected in an area within a certain time period. Usually, the cases are presumed to have a common cause or be related in some way. An epidemic is similar to an outbreak, but with a larger number of cases or occurring over a greater area. A pandemic is like an epidemic, but even more widespread, over several countries or continents. Most of the diseases posing the greatest risks to humans are contagious, meaning that they are caused by an infectious agent and can be spread from person to person. Although many of these diseases are well known, novel diseases will continue to emerge and challenge us.